This video shows how to don and doff personal protective equipment, or PPE, used for 2019 novel coronavirus in an inpatient setting. These guidelines are adapted from CDC guidance. Please refer to the written step-by-step instructions for donning and doffing PPE that are available on the COVID-19 communication page for more detailed information. First, Megan ensures personal items are removed and long hair is secured with a tie. She performs hand hygiene with alcohol-based rub. Megan has long hair, so she chooses to don a bouffant now. This step is optional for those with short hair. As she dons each item, she will visually inspect all PPE prior to donning to assure that it's not torn or ripped. This demonstration uses a launderable gown ensemble and a trained observer. Megan puts on her launderable gown. Next, Megan chooses the appropriate mask and eye protection, in this case, an integrated mask with face shield. She pinches the mask over her nose to ensure a good fit. If the eye protection weren't integrated, she would don it over the mask at this time. For 2019 novel coronavirus, the face shield is the preferred method of eye protection to help protect the mask and eyes from contamination. She then dons gloves and ensures the cuffs are pulled over the gown sleeves. Megan makes sure she is comfortable and able to go through a range of motion while remaining correctly covered. Now she's ready to enter the room. As Megan exits the room, she knows her PPE is contaminated and she and her trained observer should follow doffing guidelines carefully. Megan uses an Oxivir wipe to wipe down the door handle. She should not touch the handle again after this is done without wiping it down again. Outside the room, the trained observer performs hand hygiene, dons gloves, and wipes down the door handle. This is also a chance for the trained observer to prepare the doffing area, including getting bins and containers ready. Inside the room, Megan uses standard aseptic technique to remove her gloves first. She can then dispose of them. Megan now faces the patient and removes the gown, touching only the inside of the gown and turning it inside out and into a ball with the inside of the gown facing outward. She can then put the gown into a soiled linen hamper. She then performs hand hygiene again. Megan lets the trained observer know that she's ready to leave the room, and the trained observer opens the door from the outside to let her exit the room and enter the doffing area. The trained observer picks up the checklist and helps Megan move through the rest of the doffing procedures. She performs hand hygiene and then dons clean gloves. Next, Megan removes her integrated face shield and mask by grasping the elastic straps and carefully pulling them away from her face. Then disinfecting with an Oxivir wipe and placing it into the designated container for reuse. If the mask and eye protection are separate, remove the eye protection first and disinfect it, and then discard the mask. Megan can then remove and discard the bouffant. Finally, Megan removes and discards the gloves and performs hand hygiene one last time. When the doffing procedure is all over, the trained observer can also remove and discard their gloves.